say right at the beginning, the lockdown continues. If you remember the president announced that he will be doing these 14-day cycles where there's really just reviewing of the progress and so on. That review of the progress is what has been happening with the Working Party, Task Force, and of course quite clearly what's happening here as well. And so it has remained in place. A lot of people were calling me this morning, yesterday, saying, what's happening? Is this now, are we having relaxation of restrictions, or are we tightening up? This morning especially, there are a lot of people who were struggling on the roads because there's a tightening up. The reason why there is actually a tightening up of the enforcement of the existing lockdown processes is because as we looked at the numbers which the Ministry of Health and Childcare are obviously going to give us through the surveillance, the lab, and so on and so on, it has been noted that we have a lot of challenges at the ports of entry. That's the biggest gap or our risk area. And that if we're looking at what's happening, it looks like people have just relaxed. They seem to think the lockdown is over, and hence the recommendation, one of the recommendations was really there's need to enforce the existing restrictions and so on. So what is happening, what has been happening this morning is not because things have changed, but because the law enforcement subcommittee has been requested to step up and try and really enforce, ensuring that people are social distancing, that they're not just driving down the road when they're really not supposed to be driving down the road and so that's going to be a little bit stormy, if you like, as they're trying to do their work. But you obviously have to bear with them. Of course, the recommendations from themselves, the law enforcement, was that if there are any things that are not working well on the roads and so on, please don't hesitate to say so that they can be looked at.
So thank you very much. May I ask the pillar leads to now give us their presentation?
Thank you, Seth. I'm going to make an update on the left pillar. Currently, we have put our capacity to 1,000 tests a day, but we are operating with 500 tests a day on average, which is due to lack of commodities, which in most of the cases are not the tests themselves, but are other commodities that are used during testing. So we are also using the GeneXpert, which we have decentralized to all provincial hospitals, and we have received so far 2 batches of 3,600 tests each, and also the first batch was 300 tests. So we then also intend to increase our capacity when we have a consistent supply of commodities, and this is through the introduction of shifts, like has been mentioned in a question by Dr. Zisho. So this is a summary of the tests that we have done, and we have stratified the tests by province. Now that we are a couple of months into the outbreak, we now need to come up with protocols on how to then go into our risky populations and try to analyze and see the extent of the outbreak and the extent of the infections in the population. So we intend really to use the rapid diagnostic tests to see those that have been exposed and not, and probably try to come up with extrapolations from that data. I agree with you that we need to test 3 to 5% of the population before end of the last quarter. So that one we have also started now reviewing the other strategies that have been used by other countries, the United Kingdom, South Africa, on the escalation of testing. How then we escalate the testing in the low risk high-risk, issues to do with pooling of samples, issues to do with targeting those that are at high risk. So that one is it's one of the things on our plate, and we are working to see to it that first we prioritize that are at risk, like the quarantine centers and the returnees. Then we have the liberty now to test everyone at large. We will be running concurrently samples that would have been collected from the commercially made viral transport media, and also 0.9% saline and phosphate buffered saline, and then compare the results and also run them at a different time interval for 7 days. But the knowledge that we have in discussions we have had also with our counterparts from our partners have shown that it can be used in resource poor settings and still give the same results. So this is where we are, and this is the end of the testing update.
The National Reference Lab should work 24 hours. We have asked the lab to identify people and make sure that there is 24-hour cover. If that is not happening, I think it's something that we can look at and see how we can streamline it so that we are more effective. Especially now in ensuring that we don't have unnecessary backlogs. If we have the reagents, if we have the machines, if we have the human resources, I don't see why we should be continuing to talk about backlogs. So if it means that people have to work 24 hours, we will certainly put that into practice.
The use of illegal entries. I think you know that we assist with the border jumpers that have almost flooded our country. So every day we hear reports from the police, from the community, complaining that they are holding people that have used illegal entries. And I know that we are all aware that it's dangerous. You can't just go and apprehend, because in the process you might also end up getting the disease. So we are meeting at 2:30 with the security sector this afternoon to discuss the modalities, because I think from the weekend up to now we've got 12 that have been cited in Harare. And even at the beginning of the meeting, Dr. Ori had another call. So what we see how best guidelines that we will be using in bringing these people to quarantine centers. We have also made recommendations that should be adopted to make our submissions to the National Task Force, that all the retainees, before they are quarantined or on quarantine or as soon as they arrive, will confiscate their traveling documents. This is an international best practice, and they will get them after serving the quarantine. It's an international best practice. If you read, this is what is happening in other countries, and it will also reduce the issue of absconders. Then you will also give them certificates at every stage. Say at 80 days, they are given a certificate to show that they've done the 8 days, and after 21 days, you also give them certificates together with their documents. So there is the way forward, but it will make sense when I go through the assessment report, which I will just summarize, that our officers in quarantine centers need to be trained so that they can harmonize their operations. And we are talking of officers not only from Ministry of Health, but from the security sector and social welfare. Then we need community awareness, especially in the event of strengthening our follow-ups, contact tracing, as well as abscondees and illegal, those border jumpers. And we have to strengthen our reporting system so that it is available to policymakers and all those that are interested. There are about 55, let me say 60 quarantine centers in the country, but we managed to access 37 because some of the 60 might not be occupied. So we looked at the 37 across all provinces, and the issues to do with the responsible authority, most of them, 34, belong to Ministry of Education, and a few belong to Public Service Commission. One is a hotel, and another is a Forest Commission Training Center. The capacity of these facilities, in terms of bed occupants, 5,790, but at the time of the assessment, the bed occupants was 1,889. You know, most of the rooms that are at these quarantine centers are double rooms in general, but we also have hostels that are used in some of the quarantine centers. Ablution facilities, these are all shared, and the ratio per facility varies from 2 per square or to 2 retainees per square to as many as 20 per square. We know that if we use our school proportions, this is within the acceptable range. Then the coordination, the leadership, most of these are led by the Ministry of Higher and Tertiary Education. The principals and headmasters are in charge, and the social welfare, of course, is also the lead.
So thank you very much. We'll meet again next week. As I said, next week it will be on Wednesday.